All right. Well, thank you for logging in. I see you're kind of at the same place you were last time we talked. Yep, still at
Yep.
home.
Yep, I'm still staying with my friend in Oakland.
Okay, cool. Is that a pretty private place?
Yeah, there's no one here. No one comes home for another like 30 minutes.
Oh, good. Okay, that's perfect because that'll probably be the time we meet.
Yeah.
So I guess I wanted to start out to see if you had any questions or reactions about the last time we met.
No, I think the last time we talked about like my drinking and how I could work on that. Um, but no questions.
Yeah, okay. What was that like talking about your drinking in that way?
Um, it was fine. I mean, I don't really um think about the way I drink. I just drink. So I guess it was nice to think about it that way, or it was different to think about it that way.
Mhm. Mhm. Yeah. I think that's something that we kind of wrapped up with at the end of the session, where we were talking a little bit about your drinking, and um, I think I remember you saying something about like blacking out, and that's something that you hadn't thought about a lot, but like definitely something that you wanted to decrease um, moving forward. So
Yeah, just the not remembering.
yeah, I could totally understand why that might be a big.
But yeah, just the not yeah. The not remembering, that's the biggest issue. Um, wait, I thought I also did something else. Oh, it's social. Cannabis is social. It's like I thought there was something
Right.
else.
Yeah, I wanted to actually ask you about that because I know that we spent a lot of our time talking about alcohol last time. But I know that you had mentioned that you smoked weed too. So I was just curious if you wanted to talk a little bit about like what your relationship is with that and how often you're smoking.
Um, just when I'm out with friends.
Mm.
So like um sometimes if we're getting ready to go out and people are like drinking, then someone might pass a joint around. Or if we're like getting together to watch Game of Thrones, someone might pass a joint around. But like I don't spend money on weed. Like I'm not, yeah. So I don't use it enough for it to be like um I don't even know if I have a relationship with it. I think it's just something I do if it's available and my friends are around. Um, but it's not my go-to.
Right. Okay. So it sounds like you use it, like you just said, kind of socially, like when it's around.
Yeah, if it's around and someone's passing it and I feel like it, I'll do it. But um, yeah, I'm not gonna buy it. I'm not gonna like think about it and stuff like that.
Mhm. Is it like a daily, weekly, ever so often thing?
Um, just socially, I guess. So like weekends,
Mhm.
really. I mean, honestly, it's like a couple times a month, maybe.
Okay. Have you ever had any like, I don't know, negative side effects from it?
Oh, like tweaking, like being paranoid. No.
Yeah, like anything like that? Or it sounds like you don't spend money on it, so it's not like you've been spending all the money you're making working on it or anything. Okay.
No, I mean, I just, I'm not a, I mean, it's fine. There's nothing wrong with it. I don't just want to sit around smoking all the time. And like my friends don't really smoke that often. Maybe if more of my friends smoked, I might smoke more,
Mhm.
but they don't. So I
Mhm.
just don't have it.
Okay. You had mentioned last week too, I'm just remembering about how your drinking sometimes is a way to kind of deal with anxiety, like about being around people or when you're working. So I'm curious if weed works the same way for you, like with the anxiety piece.
Um, no, I mean like the alcohol is a little different because usually it's like I'm drinking to go on a date. So
Mhm.
like it's getting me in a happy mood. But like weed doesn't get me it gets me like in a very quiet, like I wouldn't want to smoke to go on a date because I don't think I would be a lot of fun.
Okay.
So it's not, it's just not something that,
Okay.
maybe if we're all sitting at home and we're all doing nothing, then maybe, but not if I'm out and about.
Yeah. Okay. Okay. Cool.
So yeah, I don't think it helps me with my anxiety just because like I don't use it. Well, I guess I don't think about using it for anxiety.
Mm-hmm. It's not like something that when you're feeling like you're going into an anxious situation or you're feeling anxious, like you wouldn't like think of, well, let me see. Okay.
Yeah.
But yeah, I remember us talking a little bit about that last week of your anxiety and kind of how alcohol helps. And I think you had said that, it could be cool to talk about it more in the future of like thinking of other things that might help as well. So you don't have to just rely solely on alcohol.
Yeah, I mean, like when I was in high school, one of my guidance counselors talked about possibly medication, but I don't know how I feel about that. I still don't know how I feel about that.
Yeah. Yeah. I mean, there's tons of different ways to deal with anxiety. And, I think that that's pretty common that things like anxiety or even like for other people like depression, they often really do go hand in hand with like drinking or smoking, stuff like that, because people are kind of trying to regulate those feelings. But there are other ways to kind of do it too. And we can definitely spend some time after today's session, if that's where we want to go, is kind of talking more about your anxiety. We could totally do that.
Okay.
Yeah. And I can email you some stuff too, maybe after this session about it.
Yeah. Okay.
So since today is kind of really, another one of those core sessions that everyone gets to follow up on substance use stuff, I wanted to ask about the weed, and then there was some other things that I wanted to follow up on about what we talked about last time, and just provide some more education around it. But I did want to ask too, like if there's anything that we talked about last time that you were curious about or that you had more questions about that I can make sure that we talk about.
No.
Okay, cool. I think that one of the things that we kind of talked about last time was about the connection between health and substance use, specifically for people with HIV. So I'm curious, like, to hear from you if your doctors or maybe other friends that you have, like, notice a connection of health and substance use, specifically for people with HIV.
I mean, like I know if you don't take your meds, you can get sick.
Mm-hmm.
And they're more effective if you take them at the right time. But no, I don't think so. I don't really have like a doctor, so I don't know if I've ever like talked to anyone about this.
Yeah.
But no, I don't think so.
Yeah. Is it something you've ever been curious about?
Not really. Like um, yeah, no, not really.
Okay.
Not really. I just feel like I have other stuff going on, and like when first I was undocumented, so then I had to get insurance, and then everything just kind of took a long time, and then I just stopped going.
Mm-hmm. Mm-hmm. Have you noticed a change in your health, like since you've been drinking and working and all of that? Have you noticed a change?
No, I haven't.
Okay, so you still feel pretty healthy and everything's good. Okay, that's good.
I mean, but I also like if something really bad happens, I'll go to the hospital.
Yeah.
Yeah, but I just think that no one has ever like. I think probably because I only go when I'm really sick.
Mm-hmm.
Like it's hard to talk to someone about health when they're like really sick. So I think that's probably why no one is actually. Yeah, because I don't think anyone's ever had a conversation with me about it.
Mm-hmm. Yeah, yeah, you're totally right. Like it's hard to talk about things that maybe aren't as important with your doctor when you go to the hospital primarily when there's something really important going on. Yeah.
Yeah.
Yeah, and I really liked your point too about like how drinking or drugs, like it can impact it to where you get to that place where things are, you're really not feeling good because
Mm.
you might not take your medicine on time. You know, alcohol and other drugs already just kind of decrease your immune system. So there's a lot of, ways that alcohol and other drugs make it so that you're more susceptible to just like regular illnesses like colds, all of that. So, on top of that, having HIV, it's really important to make sure you're doing all you can to make sure your immune system is tip top shape. So, yeah, I could see how, like, I hear that a lot. Like, if people are using drugs or drinking more heavily, they might feel like they're getting sicker more often.
Yeah. I mean, I think sometimes for me too, when I think about it, like like when I feel like, how do I put it? When I feel sick, like when I'm feeling down, that's typically when I don't take care of myself. I guess take care of my health, I guess.
Hmm.
My physical health.
What do you mean, like when you're feeling sick or down?
Like when I'm feeling really depressed or really unhappy or very low, then I'm less likely to like take my meds. I'm more likely to like want to have more dates just to kind of like feel better about myself, and so that I'm more likely to drink more.
Hmm.
um so yeah, I mean, I think if ever something is making the HIV worse, it would be during the times that I don't feel like happy.
Hmm. Hmm. So it sounds like to me, like a big thing for you is like not maybe the physical health, of course, but like mental health. Like when you're feeling more mentally healthy, you're taking care of your physical health. You may are not, not necessarily drinking as much, all of that. Like you're just that's kind of the key thing, it sounds like.
Yeah, I think so. I think when I am doing better in terms of my mental health, then I'm more adherent, I guess, to the concerns of my physical health.
Hmm. Hmm. Yeah, I could see that. And when you are feeling like just, I don't know, really good, kind of strong, like mentally in a good place, what's the drinking and the smoking like then?
Um, I might go out. Well, like, okay, so if I'm feeling better, there's also just like stuff I need to do. So like if I'm feeling better, I'm more likely to drive Uber or Lyft.
Mm.
And so then I won't do as many dates. And if I'm driving, I'm not drinking.
Hmm.
Um, so I would say probably that the drinking goes down when I'm feeling better. I mean, I'll still meet up with my friends and maybe we'll get a few drinks. And then if someone has a joint, we might smoke it. But like, I would say if I'm feeling good mentally, then I'm probably drinking less.
Mm. Yeah, so like really sounds like feeling better mentally is really like a key to a lot of different things going more positively in your life.
Yeah, probably.
Hmm.
Cause yeah, typically when I like, yeah, like I don't remember the blackouts, but when I think of the weekends I blacked out, it was probably like, like after 2 weeks of being super depressed and then my friends forcing me to come out because like I don't have money, I haven't left my house, I need to shower, all that stuff. And then like, I need to deal with it. I need to deal with being around those people. I need to deal with going on the date. Um, and so yeah, I think probably those are the times that I drink too much.
Hmm. Have you ever done anything for like, I don't know, kind of maintaining good mental health? Like, have you ever seen a counselor or gotten any
I
medication?
saw someone in high school. And you also like, so yeah, I saw someone in high school, but that was like a while ago.
Yeah. Okay.
Actually, not that while ago. It was 2 years ago.
Okay.
It was 2 years ago
Because you're like 20 now.
because I'm 19.
Okay. Good to remember. Yeah.
Yes. So yes, about 2 years ago, my high school counselor told me that I should, talk to someone or maybe talk to a doctor. And I would talk to them, but that was about it.
Mhm. Did you find that helpful?
Um, I think so.
Yeah. Okay.
I mean, I kept going.
Yeah. Yeah.
Yeah.
That's cool. And I mean, I think that, there's all kinds of different resources for mental health and for substance use, and kind of some that really target both of those.
Mm,
There's counseling, like it sounds like you've done before. There's more stuff like case management, where people like assist you in kind of getting to housing stuff and getting, support around getting SSI and, different things that really just kind of take a burden off of you, I think. There's medication. It sounds like you've heard of that before. Um, and there's also some really cool free things in the communities, like free groups and just kind of like social events that some people like to go to that really help with their mood and also their, drinking or using drugs too.
mm.
Um,
I don't know how I would do in a group setting. I
mhm.
would have to think about that.
Yeah, it's not for everybody, but yeah, I mean, there's all kinds. There's stuff that like doesn't even focus on mental health or substance use at all. It could be like a meditation group,
Mm,
an art group, or something like that. Something to kind of just give yourself a little bit of a break or space to relax in the day.
mm.
So those are
Yeah.
kind of the options that are out there. Do you do anything currently for just kind of mental health coping?
No,
No.
no.
Okay.
Yeah. Not really. I mean, like, I guess like once in a while, if I have time, I'll go see a movie,
Hmm.
but that's about it.
That's a good one. So kind of giving yourself some time to relax. Yeah. Yeah. Were you using other skills in the past at all, or?
I mean, no, it's just that like, okay, so I found out I was HIV positive when I was 17, so I was still in high school. That's when I started the counseling stuff. Um, and when I came out as trans, my parents kicked me out, but I stayed friends with my sister, or we kept a relationship. So I think it's just been like, if I had skills, I think they were not enough for all the things that just happened back to back to back.
Hmm.
And whatever skills I had, um, I'm not using them.
Mm.
I mean, like, I have friends, so that's a good thing. And I
Yeah,
keep in touch with my sister. That's a good thing.
for sure.
Um, and
Yeah.
like, I'm housed. I mean, it's like a room with 7 people, but I am housed.
Yeah.
And when I'm not feeling bad, I can do Uber and Lyft. So I mean, some things are happening.
Yeah. You have a lot of good things kind of going for you that it sounds like are really good steps towards like feeling really good mentally. And at the same time, I hear you kind of saying like it would be kind of awesome to like feel even better or better more consistently.
Yeah,
Mhm. Yeah.
better more consistently.
Yeah. I can understand that. Especially because it sounds like when you're feeling better, you're taking care of yourself, you're working, you're drinking less, you're probably getting along better with your friends than because you're not blacking out as much, um, feeling less. I think we talked a little bit about like feeling embarrassed when that happens. So you're probably feeling less embarrassed even.
Yeah. I mean, like I don't know if this is fortunate. I don't know if fortunate is the right word, but like my group of friends, we drink quite a bit. So, um, you know, although I may be drinking although in some situations I may be drinking more than I should, there's always like someone who's also drinking quite a bit.
Yeah, I think I remember you mentioning that
Yeah.
like that's like something you guys kind of all do like before dates and stuff like that.
Yeah. So it's embarrassing, but typically the embarrassment doesn't last very long because someone else would do it.
Yeah.
But yeah, I'm just wondering like how many of us are just doing it because, we're not feeling good.
Hmm. Hmm. Yeah, that's a good point. And I wonder how your relationships might change if you guys were feeling better on a consistent.
Yeah.
Well, as we kind of like wrap up today, I was curious of like your thoughts or if you had any, I don't know, reactions to this conversation.
Mm, I mean, I think it's a good conversation. Made me think about a lot of stuff. Um, and I would be interested to see what the resources have to say.
Yeah, for sure. I think that I'll be sure to send you some today. And then, after this session, like I said, we can kind of go where we want to go. So, is there a specific, place you want to go after this? Like, do you want to keep talking about mental health or do you want to talk about something else?
Um,
We can decide next week too, but
yeah, I mean, I think that maybe we can, like, specifically if we can talk about like anxiety and depression, um, that might be helpful. And then like, um, I don't know, like groups for trans people, maybe
yeah,
that kind of stuff.
yeah. Okay. That's definitely a good idea. Write myself a note. Okay. All right. Well, do you have any follow-up questions for today or
No.
no? Okay, well,
I don't
I
think so.
will see you this time next week and check out your email because I'll be sure to email you some of this stuff when we're done.
All right.